mamas! So how many ultrasounds do you think you need for a low-risk healthy pregnancy? Take a moment, type in the letter A and comment below. So let's talk a little bit about what the ultrasounds are for. But before we start, my name is Midwife Kira, and as you know, I believe in truly natural birth. And if that's something that you believe in, you're gonna wanna click that subscribe button to get our Midwife Monday videos every week. This week, we're gonna talk a little bit about the importance of ultrasounds during pregnancy. If you typed in the number 2, you're correct. The first one is going to be that initial ultrasound. The reason why this one is important is because it helps us to identify your due date and is pretty exact. In fact, so exact that if you have it before the 7th week of pregnancy, it's within a few days accurate of your due date. But if you have it anytime after 9 weeks of being pregnant, it actually can be 7 to 9 days off. And so this is why your doctor is going to want to do this ultrasound early in your pregnancy, typically about 8 weeks, which is really neat because you'll see your baby is the size of like a little tiny gummy bear. It's really incredible. The second ultrasound is the anatomical ultrasound that is done at 20 weeks. Most of us think of the anatomical ultrasound as the ultrasound that gives the gender reveal, but actually you can receive an ultrasound as early as 15 weeks to get the gender of your baby. But this anatomical ultrasound is different. This ultrasound is a head-to-toe assessment of your baby, not just 10 fingers and 10 toes, but 4-chamber heart, umbilical cord has 3 vessels, where the placenta is located, what is the health of the placenta, how much amniotic fluid do we have, are your baby's kidneys both there? I mean, just literally everything we need to know about your baby. Why is this important? Well, because at 20 weeks, your baby should be completely fully formed. It just has some growing left to do. And so at this time, we can identify if something is missing that would be critical to your baby's health, or, for example, where your placenta is located. It's not uncommon to have a placenta in an abnormal location at the 20-week ultrasound. But if it doesn't move, if we don't know to follow up on it, this can become a problem later in your pregnancy. So in my perspective, from a midwife's perspective, as you know, I really believe that this anatomical ultrasound is the most important ultrasound in your pregnancy because you're planning to deliver out of the hospital. And so for us to feel confident that you are low risk, that your baby is healthy, that your placenta is in the right spot, this anatomical ultrasound really gives us all the information that we need to be able to make that judgment that it is safe, that your baby is healthy. I've noticed some OBs in the Louisiana area are doing a 3rd ultrasound in the 3rd trimester. This 3rd ultrasound not only is not really very beneficial, but also doesn't really give us a whole lot of information. This 3rd ultrasound is not routine. It is something extra that your doctors or whoever your healthcare provider is imposing on you. But for normal healthy pregnancies, we need 2 ultrasounds. Now, with that said, I want you ladies to look at the comments below and tell me how many ultrasounds did you have during your pregnancy? And I'm not talking about sneak peeks or ultrasounds that you paid for to get the 4D or the baby's heartbeat. How many ultrasounds did your healthcare provider provide for you during your pregnancy? Put the letter B and comment in that below. And also, if you have a second, tell us where you're from. Lafayette, Louisiana, it is common to have 2 ultrasounds during your pregnancy, and that's what my clients have. So even though you're seeing a midwife, these 2 ultrasounds really are important. If you have questions about any of that, go ahead and shoot me a comment, leave me a message. I'm happy to help you guys navigate these questions. So these are my ultrasound recommendations based on truly natural birth, which you know I believe in. And if you believe that too, you want to go ahead and click that subscribe button below so you can get our videos every Midwife Monday. Thank you for watching, and I'll see you ladies next week. Bye-bye.